conference, Health Tech for Equity, Health Tech for Medicaid, Designing for Equity workshop on September 13th through 15th. And Health Tech for Medicaid is a nonprofit that supports organizations out in the state of California who work with communities who either have Medicaid, use Medicaid, try to support community members or clients that have Medicaid, and all of the like. So very powerful stuff and a lot of good learning. And so some major themes that I recognized from my time were designing for agency, connection, personal growth, safety, and narrative. And so we do this a lot in our work, particularly myself through my lens of RLI. And so it was really nice to hear how they were approaching these types of components to their design process. And an example, I just shared 2 examples of what I shared on the previous slide related to major themes. But wanted to share this example that stood out to me related to designing for agency. And they elevated a really cool initiative they're doing up in Illinois at the North Illinois Food Bank, where they wanted to support communities who were food insecure. And so what came out of this design process is that they designed an app where clients could access food services via a smartphone. And so they had a pretty rigorous stewardship phase where they made space to hear the voices of the client, which is really important and foundational to, human-centered design, right? We want to listen to the people we're serving. And what they learned through that is clients wanted less choices from the food bank. Because what I learned was when they had to come in person and they had to make their selections in person, there was a lot of shame around that, right? And so they designed the app centered around choice. So clients could select the food that they wanted from the food bank without that shame there. So it's a little bit more anonymous, a little bit more secure. And so through this initiative, they've been able to serve 3.2 million meals this year through that app. So again, this is just one small example that they elevated of designing for agencies so folks could then have the power to do the things for themselves related to the food bank. So I just thought that was a really cool example. And food banks are something that are really popular, not popular, but something that are really necessary here in Eastern North Carolina, particularly. I've frequented them, in different moments of my life. And definitely this story certainly resonated with me because I saw my mother, my aunts, Miss Verdi down the street, who all go to food banks here in our community. So I thought it was great that they named this example. Another example that stuck out with me was designing for personal growth. The city of South Bend wanted more access to meetups, events, jobs, trainings, resources, and really didn't have a way to put all that stuff in one place to find it accessibly and easily. And so as a result of this, the city of South Bend partnered with IDEO to create the Bendable app. There are 2 dignity components to this design. Bendable is for everyone and it is hyper accessible. In the design process, during the deep listening and the stewardship phase, the community pushed back on the login requirement because originally there was the login requirement. We have to have email and all the things, phone number. And they named very specifically that it felt easier to remove the barrier to access the app if they did away with the login requirement. And so what they elevated here is that you have to be adaptive in the design process and make data available for the community to design for, so they can then make decisions and help you design the product or program for them. And so what manifested was the final design had a no login feature, so people can access it at any time, at any place without any incident or challenge, which I think is really terrific. So those are just 2 examples of some design projects that came out of our time. Now, I also wanted to share with you some statistics that Health Tech for Medicaid shared with us that I thought were pretty substantial. And just a quick note about this photo. This photo was taken on the pier a couple of blocks from Fisherman's Wharf. So just wanted to share that little tidbit with you because these flags I thought were really beautiful and they were flowing so beautifully on a beautiful day in San Francisco. So I thought it was appropriate to add them here since we're talking about statistics related to Medicaid in our country. 81 million people on Medicaid in our country. 27 million people are food insecure. 42 million of the Medicaid insured are children. That's almost half. And 80% of all end-of-life care is paid for by Medicaid. So I thought those were some really great statistics that the org shared with us and wanted to share those with you. Because when we think about scale, right, we think about our nation, how many people are here, and we think about what these numbers mean for how people live their lives, for how, they just do a lot of things and how they receive healthcare more importantly. So just wanted to share that. And then some key takeaways I took from this is designing processes, systems, programs that promote dignity of the people that we design for. Also to explore how we might remove bias in the design. And that is something I would say that is probably the biggest key takeaway that I keep in mind when I'm doing my work since this. Like, how do I take away what I think about this and design for the people that have told me what they think about it, right? And then lastly, designing to make people feel safe and seen. That's something that I try to do in my design work. And so it was just really powerful to hear that over again, because that's an important piece of why we do human-centered design approaches anyway, and do any of the programming we do as a result. And this picture to the left is a picture of their banner, and added that there as well. And then just wanted to share a few photo highlights with you guys. This is me and Yolanda with our iteration Post-its. We had a really cool activity there. And then that's her and I in Alcatraz right here. I'm pointing like y'all can see my finger. This is her and I at the Fisherman's Wharf where Alcatraz is in the background. This is actually the Play Lab, which is actually kind of top secret, but they said that I could take pictures, so it's okay. Where they showed us some products that IDEO had worked on that they helped them develop, which was very cool. As you can see, there's like a Swiffer thingy up there, and then like the defibrillator to the left, which I think is incredibly cool. The defibrillator was a big machine previously, and the creators of that machine worked with IDEO to create a smaller version, which you see in hospitals, public areas, schools all the time. So just wanted to share that story. And then to the immediate left, that's me at the rooftop of IDEO enjoying that beautiful view they have there. And then at the bottom, a cable car. And that wraps up my share out of Designing for Equity. It was a great time, met so many people and have reached out. So many people have reached out to me as a result of it, the people I met at my table. So it was just a really beautiful opportunity, and I just appreciate the org for it. So if you have any questions, feel free to let me know.
Corey, thanks so much for creating that. Really inspiring to see the examples. What was the highlight for you?
Mac and cheese from home. No, that was really good. Thanks, VJ, for that suggestion. But I think from the content of this, just hearing the stories of how they've designed with folks's stories in mind, and like designing for narratives, I thought was like really powerful, because that was another theme that I mentioned, designing for narratives. Like, how do we design with the people's story in mind? And I thought that was just like a really powerful thing to consider. And would, as I had discussion amongst the folks at the table, that felt like something that was really important to them as well, and got a lot of energy from them around it. So that felt like a highlight, engaging in that conversation around designing for narratives with my table.
Yo, the Mac can be the highlight. That's some good Mac.
Some good Mac. Oakland is where it's at. Thank y'all for listening.
Thank you for sharing. It really makes me think Graham, you're probably tired of me always saying it, but you talking about IDEO needs to get with the state of North Carolina to help them design better enrollment process for their Healthy Opportunities pilot program. And then
yeah, that would be awesome.
their work around that. Just, yeah, see a lot of opportunity for Medicaid locally.
Also, related update on that is I talked to Naeem about how he like tried to access it, and they basically told him he doesn't have like the right type of Medicaid because he has full. I like basically I think it's at first I was like that's so stupid, but then apparently like what he has does already cover some of these things, so it kind of makes sense. But yeah, they also need to like more clearly message which type of Medicaid you need to have. So I totally agree. IDEO, if we could get like the state to hire IDEO or something, that would be a huge victory.
I think typically what happens with that is that Medicaid is like the secondary insurance for people of a certain age or health level. And so Medicare is first. And then Medicaid will pick up whatever Medicare doesn't. So that's usually how that works. And then some people have like a tertiary insurance if they're like a veteran, or so they'll have three. So it's very complex insurance. And I learned that when I was working with Rural Health Group in Rolana, how that works together and how it can be very like isolating and like hard for folks to get the things that they need because of bureaucracy associated with some of the processes for Medicaid, Medicare, and the like. So yeah, I linked the deck in here. I realized I didn't do that before. And so if you guys want to like refer back to it, feel free. Because I found that to be really, really a powerful time. So definitely refer to it if you think it can help you in your work.